Although progress has been made in HIV prevention efforts, there's still a long way to go in reducing new HIV infections by less than 370,000 annually by 2025. While in East and Southern Africa, about 3,100 girls are infected each week. This calls for a multisectoral approach to address barriers hindering progress. One such is funding and strong political will to, among others, address policy and legal barriers that continue to impede access to HIV services.
We need to intensify our efforts in advocating for the removal of harmful laws that Victoria and Solomon just highlighted, and ensure that we create an enabling environment conducive to HIV prevention service and delivery and access. Secondly, we need to increase HIV prevention financing. While we can leverage global resources, we need to, in the spirit of shared responsibility and global solidarity, lobby within our own governments to increase and/or allocate some domestic resources to HIV prevention.
Many HIV patients still struggle to access HIV prevention services owing to persisting inequalities and violation of human rights. The HIV Multisectoral Leadership Forum will thus focus on leadership for multisectoral approaches to HIV management to help maintain the virus' primary prevention agenda. At the event, the HIV Leadership Forum position paper and policy brief on the leadership role of national AIDS coordinating authorities in HIV prevention and sustainable health was launched.
We all know that HIV prevention has to be holistic. We cannot win this fight if our solutions do not address underlying socioeconomic, cultural, and structural barriers that predispose key and vulnerable populations. The technical deliberations of the next 2 days will be defined by two truths. One truth is that we are almost there. An AIDS-free generation is possible. We can feel it. We can see it. Second truth is that the risks of losing momentum is real. We can see the risks, we can feel them.
And then not refuse, but then we have to think what we really mean by that multi-sector. And that is why we're talking about investing in building a strong national HIV prevention system that cut across the workforce, the supply chains, the diagnostic, the cross-sector delivery, the monitoring beyond the projects. And this is what we are calling ourselves to, looking beyond the small little projects that we have.
The forum is held under the theme Sustaining Effective Leadership to Secure Gains, Bridge Disparities, and Expedite Progress in HIV Prevention Efforts. Siaman Pikwa, NPC News, Windhoek.